Hello friends, good evening. Welcome to my channel. Please subscribe to my channel. So today we are going to discuss about the spiders from the skull and the spiders which they ask from the brain and spinal cord. Let us discuss about it. Yes, coming to the skull base. In our previous classes we have seen the anterior view of the skull and superior view of the skull and lateral view of the skull. Now the questions usually they ask from the base. What are the questions? Let us see that. So as the slide, the photograph is a little smaller, so I just want to take it into two parts. I'll just divide it into two parts and I will discuss and I will expose and I will show clearly the foraminas which usually they ask in the examination. Okay, so as usually you will get only 1 minute time. In 1 minute time you have to find out that foraminas and you have to find out the spiders and write the answers. So how to identify the foraminas and how to identify the features. So in the skull base, when you just try to see that, sometimes they may mark any particular area and ask you to identify that area. So, and sometimes they may pass any probe in any foraminas and ask you to identify the probed foramen. So first I will explain. Most probably what they ask is, this is the hard palate. Hard palate is made up of two pairs of bones. One is anteriorly, we can see the maxilla, and posteriorly the palatine bones. Sometimes they may mark this and ask you to identify that. And behind that there is a thin bone is called as, that is vomer. Okay, and lateral to this vomer, these two apertures called as posterior nasal apertures or conae. And lateral to this conae we can identify two plates. Sometimes they may mark this and ask you to identify that. So the one which is present medially, that is nothing but the medial pterygoid plate. The one which is present laterally, that is called as lateral pterygoid plate. And sometimes they may mark this particular area which is present posterior to the vomer, that is called as basilar part of occipital bone. On the basilar part of occipital bone they may mark this area. What you have to write is, you have to write as basilar part of occipital bone. Sometimes they may mark only this particular tubercle. Okay, there is a projection. The projection they may mark and ask you to identify the tubercle, that is called as pharyngeal tubercle. Okay, let us discuss about the foraminas. So these are the foraminas usually they ask. Let me show you all the foraminas usually they ask. So the first and foremost is on the palate, on the hard palate, the foramina which is present, it is called as greater palatine foramina. Greater palatine foramina. Then the structures passing through the greater palatine foramina you have to study. Okay, then behind the greater palatine foramina we can identify small foraminas. They are called as lesser palatine foraminas. Lesser palatine foraminas. Okay, then after that, lateral to this basilar part of occipital bone and behind the medial pterygoid plate there is an irregular shape foramina. If you find the probe is passed in any irregular shape foramina, that it is called as foramina lacerum. Foramina lacerum. Then after that, behind this lateral pterygoid plate, that is a foramen, oval shaped foramen, that is called as foramina ovale. And posterolateral to this foramina ovale, we can identify foramina spinosum. Foramina spinosum. And behind this spinosum, exactly is posterior to the spinosum, they may pass any probe in this particular foramina. That foramina is called as carotid canal. Carotid canal. Okay, so foramina names are very easy. Okay, on the hard palate there are two pairs of foraminas, greater palatine foramina, then lesser palatine foramina. Then behind the medial pterygoid plate, irregular shape foramina, that is called as foramina lacerum. Then behind the lateral pterygoid plate, that is called as foramina ovale, and posterolateral to this foramina ovale, foramina spinosum, and posterior to the foramina spinosum, that is called as carotid canal. It is very easy. You have to study the structures passing through each and every foramina. For suppose greater palatine foramina passing greater palatine vessels and nerves, lesser palatine foramina passing lesser palatine vessels and nerves, then ovale passing. There is a mnemonic for every structure. Okay, so ovale passing male structures. It says, some textbook says that male, mandibular nerve, accessory meningeal vessels, lesser petrosal nerve and emissary veins, and spinosum passing middle meningeal artery, and carotid canal is passing internal carotid artery. Okay, that like that you can just have a look at it, study about it. I'm just in this lesson I'm going to show how to identify that foraminas, and your turn is you have to study which structures are passing through that. Okay, that is about this base part, and then posterior part I will expose now. Yeah, this is the posterior part. What are the foraminas usually they ask is, here you can see that stylomastoid foramina, which is present between mastoid process and the styloid process, that it is passing the facial nerve on the stylomastoid artery. Then there is a other foramina which is present medial to the stylomastoid foramina. That is called as jugular foramina. Jugular foramina. You can easily identify the jugular foramina, and you can find any. There is a plate. There is a depression. Then depression, and there is a plate is present in that. So that fossa, there is a depression that is called a jugular fossa. If the probe is passed into the foramen, that is called a jugular foramen. Jugular foramen. Yes, coming to the next foramina is the bigger foramina. This is called as foramina magnum. So foramina magnum, it is very big of foramina. The many structures are passing through that. So you have to be very careful. And sometimes they may give a tricky question. What are the structures passing through the anterior part of foramina magnum? Or sometimes they may ask, what are the structures passing through the posterior part of the foramina magnum? So anterior part is called as osteoponeurotic canal, and posterior part is called as neurovascular canal. So what are the structures are passing through the anterior part that you have to study? So that is the tip of the dens, you can identify anterior longitudinal ligament, and then tectorial membrane. Like that, some structures they are passing through the anterior compartment. It is a narrow one. And lateral to this foramina magnum, we can identify occipital condyles. Sometimes they may mark this and ask you to identify that, and you have to write it as occipital condyles. Next, we will see the interior of the skull. That is a cranial cavity. I am going to show you the cranial cavity base. Yeah, cranial cavity base. This also I have just divided into two parts. I am going to show you three different fossae. And in this picture, you can see that anterior cranial cavity, middle cranial cavity. In the next slide, I am going to show the posterior cranial cavity. So here in this picture, what are the foraminas they ask is, first and foremost foramina which is present actually in front of the crista galli. There is a bony projection which is a part of ethmoid bone. So the foramen which is present exactly anterior to that, that is called as foramina cecum. Foramina cecum. So you write down and try to see this many times and remember that. And if you just correlate with the dry skull, that it is very, very helpful. If you have the dry skull, you try to study here, try to see this video and find out on the dry skull. Then it is very easy to remember. Okay, no need to worry. Now, so this is about the foramina cecum identification. And sometimes they may mark this area. If they mark this median part, that is called as crista galli. If they mark on either side of the crista galli, that you have to write as cribriform plate of ethmoid bone. Cribriform plate of ethmoid bone. Then in the anterior cranial cavity, I am discussing now. Okay, in the anterior cranial cavity, crista galli, there is a bony projection which is projecting upwards. On either side, there is cribriform plate of ethmoid bone. And if they mark exactly in front of the crista galli, there is any other bony projection which is projecting posterior, that is called as frontal crest. Frontal crest. Okay, if they mark this area, it is called as orbital plate of frontal bone. Orbital plate of frontal bone. Then we are moving to the next cranial cavity, is middle cranial cavity. So try to observe that the probe is passing in which cranial cavity. In the anterior cranial cavity, you have to remember one is foramina cecum. Then sometimes they may ask this particular small foramina if it is visible properly. Okay, so here two foramina should be there. If the foramina, if they pass any probe in the anterior foramina, that is called as anterior ethmoidal foramina. If they pass in the posterior most foramina, that it is called as posterior ethmoidal foramina. Posterior ethmoidal foramina, it is present here. Okay, so for that you must have a good eyesight to identify the two small ethmoidal foramina. Sometimes you may get confused, so examiners, they doesn't want you to be in trouble, so they doesn't ask this, but remember that for time being. Okay, then we are moving to the middle cranial cavity. In the middle cranial cavity, just this part is called as lesser wing of sphenoid bone. Lesser wing of sphenoid bone. This posterior most projection, it is projecting posterior-medially, that it is called as anterior clinoidal process. Sometimes they may mark this and ask you. Okay, so that is called as anterior clinoidal process. Then just below to this lesser wing of sphenoid bone, there is a fissure called as, if they pass into this fissure any probe, that it is called as superior orbital fissure. So where it is present? It is present underlying the lesser wing of sphenoid bone. Then medial to the lesser wing of sphenoid bone, there is another foramina. If they pass any probe or any needle into this foramina, that is called as optic canal. Okay, this is called as optic canal. Then we are moving to the next structure is just behind this superior orbital fissure. That foramen, actually, if you just look from above, you may not find clearly. So you need to just try to see that from posterior aspect. Just try to tilt it down, try to move back and try to observe this foramina. So if the foramen exactly present posterior to this superior orbital fissure, that foramina is called as foramina rotundum. Foramina rotundum. Okay, then medial to this foramina rotundum, and there is a small groove. Sometimes they may mark this and ask you to identify the groove, that it is called as carotid groove. It is for the internal carotid artery. Then behind this foramina rotundum, behind the foramina rotundum, what we can identify is irregular shaped foramina, that is already have seen at the base, that it is called as foramina lacerum. Foramina lacerum. So the foramina it means that lacerated foramina. Okay, then we are moving to the other foraminas, two foraminas which you have seen already in the base. That it is a oval shaped foramina, foramina ovale, and then posterior to this foramina ovale, that it is called as a small foramina called as foramina spinosa. So far we have seen the foramina ovale, and then posterior lateral to this foramina ovale, the small foramina, this is called as foramina spinosum. Foramina spinosum, already have seen that at the base. Okay, so these are the foraminas which we can identify in the anterior cranial cavity, middle cranial cavity. And then we are moving to the posterior cranial cavity. Posterior cranial cavity, what are the structures, what are the foraminas usually they ask? So you have to be very careful be in the posterior cranial cavity. Why? Because so this internal artery meatus, that it is not visible if you're not observing that skull carefully. So you have to just try to move on either side, try to move to the left side, move to the right side, and identify that on the dry skull. Then only you can identify this internal artery meatus. Let me show you that. So the first and foremost foramina which we usually they ask is internal auditory meatus. So to see that internal auditory meatus, you have to just try to move to the opposite side. If they ask about the right-sided internal auditory meatus, you have to move to the left side and try to observe that clearly. Just move back and try to turn your head up, turn your head down, and try to observe that it is called as internal auditory meatus. Okay, then moving to the other foramina is just below that we can identify the bigger foramina, that is called as jugular foramina. Okay, that is called as jugular foramina. Then moving to the on either side of the foramina magnum, we can identify another foramina called as hypoglossal canal. Hypoglossal canal. And then we are moving to the bigger foramina called as foramina magnum. Same thing which I am going to tell you. So anterior part is called as osteoponeurotic canal, and posterior part is called as neurovascular canal. Okay, so these are the foraminas, and this is the identification, how to identify these foraminas. And now we are moving to the next structure is the dural folds. The dural folds, this is also the smartest question usually they ask. Okay, so the bigger dural fold, which is called as falx cerebri. So okay, they may pin this structure and ask you to identify that pin structure and name the dural venous sinuses present in it. So what are the dural venous sinuses present in it? So above one is superior sagittal sinus, below one is inferior sagittal sinus, and also this is called as straight sinus. Okay, these are the usually they ask from the cranial cavity is this. Okay, falx cerebri. Then just below to this one, this is called as falx cerebelli. Falx cerebelli. Okay, falx cerebelli, they may ask. The next question is, so here you can see that tentorium cerebelli. Just below to this cerebellum, there is a tent-shaped structure, dural fold. So the name itself, it is giving you an idea, tent over cerebellum, tentorium cerebelli. It is very easily you can remember that. So what are the dural venous sinuses present in the dural fold? That is called as tentorium cerebelli identification. Then moving to the neuroanatomy, smartest questions usually they ask is, so cerebrum. So upper part is called as this is called as cerebrum. Identification is very easy. And then below to this tentorium cerebelli, that is called as cerebellum. So the next questions, what they usually ask from the cerebrum. Cerebrum, they may ask you the lobes of the cerebrum. and cerebellum. So they may ask you any two nuclei of the cerebellum. So what you have to write is, so what are the nuclei? Dentate nucleus you can write. So any nuclei which you remember, you can write in the cerebellum. Then we are moving to the base of the brain. What are the questions usually they ask from the base of the brain? Let me show you that. First one is olfactory tract. They may pin this structure and ask you to identify that. Okay, so what you have to write is olfactory tract. Olfactory tract. Then the further question is, so the olfactory nerves, they pass through which foramina, they may ask. Olfactory nerves, they may pass through which foramina. So which foramina? That is cribriform plate of ethmoid bone. Then moving to the next is optic chiasma. Optic chiasma. So right and left optic nerves. Same question they may ask. Optic nerves, they are passing through which foramina, they may ask. Optic nerves. So optic nerves, they are passing through the optic canal. Then moving to the next, there are two bulbs-like structures which are exactly present behind the optic chiasma. Small bulbs-like structures, they are called as mammillary bodies. Okay, mammillary bodies. Then behind that, we can identify the pons. So which are visible, those structures only they ask. So you don't need to panic, don't worry, try to observe that clearly. Okay, so the bigger structures they may ask. So olfactory tract we have seen, optic chiasma, mammillary bodies, then the pons. This is called as pons. Then the medulla oblongata. This is called as medulla oblongata. So regarding the pons and medulla oblongata, they may ask you what are the nuclei present in the pons. Medulla oblongata, what are the parts of the medulla oblongata? External parts, olives, pyramids, like that you have to write about it. Okay, so that is about the base of the brain. Then next we are moving to the other structures are in the medial surface of the cerebellum. They may ask this structure, which is called as corpus callosum. Okay, corpus callosum. So they may ask you the parts of corpus callosum. What you have to write is rostrum, genu, trunk or body, then splenium. Okay, rostrum, then curved bend called as genu, then trunk or the body, and most posterior part is called as splenium. Okay, then next structure usually they ask is the fourth ventricle. How to identify the fourth ventricle? Exactly in front of the cerebellum, there is a triangular shaped structure, just like a tent. Okay, so triangular shaped structure, that is nothing but the fourth ventricle. So fourth ventricle, so they may ask what are the openings of the fourth ventricle, like that they may ask. Okay, so then next structure is just below to this, below to the corpus callosum. They may ask this structure if it is present. It is very small structure, that is pituitary gland. If you yes, next thing which we are going to see is the cingulate gyrus, just above the corpus callosum. If they pin the structure and ask you to identify the gyrus, that is called as cingulate gyrus. Cingulate gyrus. Then medial structures are just below the corpus callosum. We can identify the thalamus. So if they pin the structure, you have to write as thalamus, or you can write it as interthalamic adhesion. Interthalamic adhesion. Just below the thalamus, you may find any sulcus. That sulcus is called as hypothalamic sulcus. Below the hypothalamic sulcus, there is nothing but the hypothalamus. Okay, so hypothalamus also they may pin and ask you to identify that. And regarding the thalamus and the hypothalamus, they may ask you the nucleus. They may ask you the nucleus. And then moving to the just behind that, below that, we can identify the midbrain. Midbrain. Okay, so above the pons, there is nothing but the midbrain. Okay, same thing. Here you can see the fourth ventricle, then cerebellum, and this structure is called a cerebrum. Then moving to the spinal cord. Moving to the spinal cord. So actually, what they ask regarding the spinal cord is lower end of the spinal cord. They may ask lower end of the spinal cord. Entire this horse tail appearance. That it is nothing but the cauda equina. Cauda equina. Okay, and the next structure is from the spinal cord. The lower end of the spinal cord, there is a projection which is extending. This is a modification of the pia mater called as phylum terminal. Phylum terminal. Remember this phylum terminal. And other structures which usually we cannot identify anything, that doesn't ask if the specimen is visible, if the specimen is available, only they keep spinal cord. instead of keeping in the intact spinal cord, they may remove the spinal cord and keep in the examinations. Okay, so that is about the identification of a neuroanatomy spotters and this spotters from the skull. Okay, so that is about this class, and tomorrow in next class we are going to discuss about the nerves of upper limb. See you soon, guys. Thanks for watching. Please subscribe to my channel.